Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning will begin on a local community health center that's committed to removing barriers and improving health outcomes to promote quality of life and reduce disparities among racial and ethnic communities. Milwaukee Health Services Incorporated. My first guests are Dr. Aronica Williams. She's the Chief Medical Officer at Milwaukee Health Services Incorporated, and Pamela Clark, who works as the Corporate Communications Specialist. Good morning, ladies.
Good morning.
Thank you for being here. And Milwaukee Health Services Incorporated has been providing quality healthcare services in the Milwaukee area for over 25 years. So tell us a little bit more about the specific services that you offer to those in the community.
Well, we offer full spectrum primary care, so family medicine, internal medicine, pediatrics, women's health. So we have something for the entire family, but we also offer specialized services with a on-site podiatrist, on-site behavioral health. And one of the things that we're noticing is that in our community, but across the country, there's really a shortage of behavioral health specialists. So we are fortunate to have several behavioral health providers who are doing both counseling and prescribing medicines. We also have on-site pharmacy and on-site x-ray, and on-site dentistry. So we try to be that one-stop shop for all patients.
It's all right there. And there are a number of health disparities, needless to say, among racial and ethnic communities. For instance, African Americans are 60% more likely to be diabetic. And so when you talk about that, it's helpful to have a podiatrist on hand when people have feet problems and things like that. And then you've got 40% of African Americans who are more likely to die from stroke and breast cancer. So when you look at those type of numbers and being able to be a community health center that is right in the heart of where people live, it really does make a difference.
Absolutely. Yeah. And we try to make sure that we get patients before they get those conditions, and so we want to focus on prevention, but also treatment as well, and making sure we're connecting patients with the appropriate specialists for the conditions that are particular to their individual case.
Yeah, and we'll get back to some of the things that you offer as far as healthcare, but for the second year in a row, Ms. Pamela, you're creating an opportunity to not only teach, influence, inform, and entertain. I mean, it's all of these things that you're doing with your Laughter for the Soul too. Yes.
Laughter for the Soul too.
Because this is the second year.
This is the second year.
Tell us more about it.
It's going to be on Sunday, September 24th at 3 p.m. at the Marquette University Varsity Theater. That's on 13th in Wisconsin. And we're having local comedians, a local band, local DJ, but our featured person is Cedric The Entertainer.
Cedric The Entertainer.
Cedric.
Needless to say, one of the kings of comedy, also an outstanding actor, and he really does care about people's health, because he's come to Milwaukee not once, not twice, a number of times to really lend his celebrity to help get the message across of how important it is to take care of yourself. And he's got a foundation as well, right?
He does have a foundation. This is Cedric's third time coming to Milwaukee, and he's come to Milwaukee Health Services each time. His specialty, what he really likes to talk about, is diabetes. As some people see the commercial that his father suffers from diabetes, so he talks about diabetic nerve pain. But and another one, what he cares about is women's health. So on top of Cedric coming to perform for Laughter for the Soul, he'll also be giving away trips to St. Louis to attend his gala, which is focused on women's health.
Wow. So we've got to break down this event that's happening on Sunday, September 24th. 3 o'clock is showtime.
3 o'clock is showtime.
I am excited to be a host
for
a second year in a row. And you've got some local comedians who are going to be joining Cedric and showcasing their talents as well.
Well, the show will start off with our local band, Christopher's Project, featuring Mr. Jackie Caldwell.
Yes.
We have DJ Cheerio, he's our DJ for the whole program. And then we'll have D-Rock, who's a local comedian.
He's been on the show before, yes.
Marlon Hill, and then we're bringing back Kelly Kales, who now she's moved to New York, but she she's coming back home to do the show for us.
Yes, and they're all super hilarious.
It's going to be
a lot of fun.
And I think one of the best things out of this show is we're going to have a lot of audience participation because we're going to be playing Name That Tune. So you know.
That's going to be fun in itself because from working in radio, I know people make up their own titles of songs, so that makes it fun in
hilarious.
But that's where they're going to get a chance to compete for this trip to St. Louis. And at Cedric's Gala in St. Louis, he's going to have featured Sheila E., not to get the two confused.
Right. He's going to have Sheila E. at his concert. It starts off with, they'll get the prizes, a round trip motor coach to St. Louis, hotel, and then to Cedric's Gala, which will consist of a private reception, and then you go to the concert, which will feature Sheila E., and after that is the after party, which is fun, so you'll get a chance to party with Cedric. All
right, so if someone wants more information on how they can grab a ticket while they last,
you need to say it. Who do they need to call? Call Pamela Clark. Call Pamela Clark at 414-267-2655, or you can go to our website, www.mhsi.org.
All right.
The tickets are $25 or $40.
Okay, and it is a major fundraiser for Milwaukee Health Services Incorporated, so it's important to let people know that it's a win-win scenario.
It is a win-win.
Yeah, and I'm looking forward to it.
I can't wait.
Dr. Williams, September is National Childhood Obesity Month, so you've got about 1 in 3 children between the ages of 2 and 19 in the U.S. who are considered obese, and they're most likely to be obese adults. Yep. That's an important thing, especially when we talk about childhood diabetes, things of that nature. What tips do you have for parents who are at home who like to stop and get a quick meal at McDonald's or whatever the case, not to call out McDonald's, but you know what I mean, fast food? What advice do you have for them in making sure their child is on the right track to being a healthy adult?
Well, the main piece of advice that I would give is get moving. And I think that that was one of the things that has been a focus nationally for several years. We want to make sure that everyone in the family is participating in physical activity. You want to limit sugary beverages, and so some of the things that I tell my patients is that juice, soda, those things should be reserved for special occasions. So we need to basically be focusing more on water, more on milk, and the thing is that anybody above the age of 2 should not be drinking whole milk, because it has too much milk fat. And so between the ages of 1 and 2, actually that fat in that milk is needed to help create the sheath for nerves so that they fire properly. But after the age of 2, we need to go down to 2% or even to 1%. And so we got to make sure we're staying moving. We need to eat a healthy diet. So more soaked fruits and vegetables, things like that, and making sure that we're drinking more water. But the whole family needs to get moving. And I think sometimes too, when we're in this immediate society where we're kind of throwing phones and video games and those types of things, we've kind of gotten away from go outside and play. Remember, we played until the street lights came on and those types of things. So we have to make sure that the whole family gets moving. But the other thing is that we want to make sure we're decreasing the chance that those kids are developing those adult type diseases. So we're seeing, like you mentioned, more childhood diabetes, more childhood high blood pressure, things like that, more childhood elevated cholesterol. So when we get moving, we have a healthier diet, we have healthier children, healthier families, healthier communities.
Yeah, and our former First Lady, Michelle Obama, did an outstanding job with the initiative of Let's Move, and I think that it did stick and that people do realize, but we do need to remind everybody every now and then. I was just reading that the most underrated exercise that all of us can do, usually at any age, is walking.
Yes.
It just takes care of stress, depression, weight gain, all of these things. And even if you, before it gets too cold, you just get the family out, brisk walk around the block, and everybody's gotten in that exercise they need.
And I think one of the things that we forget is that kids who are overweight tend to suffer more from bullying or depression or social isolation. So we want to make sure that our kids are being integrated in those school activities, but that we're not setting them up for some of those things that, you know, ultimately, I mean, bullying is a whole different topic, but really we want to make sure that we understand that there is a link to that social isolation and those types of things with kids who are overweight, and we want to make sure that not only are we not setting them up for certain physical ailments, but we're not setting them up for certain mental and behavioral health ailments as well.
Wow, well put. That's why we have the doctor in the house.
Absolutely.
Now, you guys have 2 locations for Milwaukee Health Services Incorporated.
We do. We have one location, it's the MLK Heritage Health Center, and that's at 2555 North MLK Drive. And we have another center, it's the Isaac Cogg's Heritage Health Center, which is 8200 West Silver Spring Drive.
And the names that these centers carry have such great significance, especially Isaac Cogg's here in the Milwaukee community.
It's our history.
Yeah, absolutely. So gotta shout out Dr. Tito Izzard, who is always working hard over at Milwaukee Health Services Incorporated as well. He's president CEO, right?
Yes. And he's still seeing patients. He's still a practicing physician.
Okay, so just a busy man all the way around, And he was born and raised here in Milwaukee. Is he a native of Milwaukee?
He is a native of Milwaukee, and he is a native, and he has the same zip code that he works in, 53212. He was raised in that area, so he wanted to bring it back.
And Dr. Williams, you have such an inspiring story as far as where you've gone to school and the things that you've done, and you left Milwaukee, and then we were so blessed to have you come back. So have you talk a little bit about your journey, just to be an inspiration to maybe a young person out there who desires to be a doctor but feels like maybe that's not within their reach. What would you say to them?
Well, I too, born and raised in Milwaukee, not too far from here, and so I wanted to pursue medicine, and I knew that in high school, but I had both an academic and a music scholarship, and so I traveled to New Orleans where I did undergrad at Loyola, and I actually was a music major, and so for people who may not necessarily know, you don't have to be a biology or a chemistry major or psychology pre-med in order to go to medical school, but to have that well-rounded background. And a lot of times, especially when people are looking to pursue, you know, becoming a doctor, they think that they have to follow one specific track, and they don't, you know what I mean? So what a doctor looks like is different, you know what I mean? Doctor looks like me, you know what I mean? And so I think that you know, I try to encourage people to kind of think outside the box and look at what they can bring to medicine, not just, you know, what they want to get, you know, from medicine. But ultimately, I started my practice after completing residency here at Columbia St. Mary's Family Medicine residency program in Charlotte, and I did urgent care, but I also worked in a number of different community health centers, much like Milwaukee Health Services in rural North Carolina. And the interesting thing that I've seen is that, you know, serving the underserved is common, you know, in different geographic areas. And so we face the same commonalities with respect to, you know, what it looks like to be poor. So being poor in Milwaukee or being poor in North Carolina, similar struggles. And so my commitment to the underserved population really goes back to just wanting to be impactful in whatever community I find myself in, and wanting to definitely make a difference for people who look like me, but regardless of what someone looks like, you know, being able to provide comprehensive and excellent health care. And I think that coming back to Milwaukee and aligning myself with the mission of Milwaukee Health Services gives me an opportunity to do that, but it also gives me an opportunity to impact change in our community and then bring somebody along with me who, you know, wants to do the same.
I love that. Doesn't she make you proud?
Yes, she does.
Thank you for sharing that. And we need to go over these details for Laughter for the Soul 2 once again, so everybody at home that wants to be in the mix with Cedric The Entertainer can do that.
Sunday, September 24th at the Marquette University Varsity Theater. If you need tickets, you can get in contact with Pamela Clark.
She speaks of herself in the third person.
Oh, that would be me, right? But I don't say it as good as you, though. I can be reached at 414-267-2655, or you can go to our website, www.mhsi.org.
Thank you so much, ladies, for coming by.
Thank
It's
you.
been a pleasure.
Thank you.
Dr. Aronica Williams is the Chief Medical Officer at Milwaukee Health Services Incorporated, and Pamela Clark, she works as the Corporate Communications Specialist. For more information on anything that we've discussed, again, you can go to their website at mhsi.org or call Pamela Clark at 414-267-2655. When we return to Our Issues Milwaukee, we'll switch gears and find out more about a youth sports league that ministers to youth through discipline, physically through basketball, and spiritually through discipleship. We'll meet representatives from the Milwaukee Christian Fellowship Basketball League right after this.